Are you the type of person that once you start something, you need to see it through to completion? Well, if so, you're not alone. In today's episode, I talk with physical therapist and certified birth healing practitioner Ann Geist about her journey to becoming certified. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this episode. Today, I have with me a special guest. She's actually become a really good friend of mine. This is Ann Geist. Ann is a physical therapist in Columbus, Ohio. She works out of Fitness Matters, and she has become certified as a birth healing practitioner. And I wanted to bring her on the podcast today to share your experience with the process of taking my courses and the certification, and just help others, help those that are listening in to get a sense of your experience with this work and the whole certification process. So welcome to the podcast, and thanks for being here.
Thank you, Lynn. I am so excited to be here and just pleased to be able to just help spread the word and of how wonderful this program has been for me and how changing it's been for my practice and how many lives have actually been changed because of the work that you have done. So thank you very much.
Awesome. Well, super. So Ann, tell us, first off, tell us a little bit about yourself.
I have been a physical therapist for over 30 years now. Hard to believe. But I started as an orthopedic specialist or orthopedic therapist with an athletic training certification. So I did that for about 15 years and then worked my way through rehab just as my children were getting a little bit more needy. And so from there, ended up injuring myself and needing a pelvic floor PT. And she said, Ann, it's time to stop lifting people and come on and join our team. So I've been a pelvic PT since 2014 and been at Fitness Matters since that time and have absolutely loved it.
Awesome. So you're also a mom. How many children do you have?
I have three. They're 29 to be 27 soon and 23. So three. And that's really how I met you, was after the birth of my first child. So yes, my sister and my sister Carol and Lynn were like good friends. So
Oh my gosh.
when
That's right.
I yeah, so when I had Mitchell, it was like a really challenging birth, and I had a lot of birth trauma, but I was like, oh, everybody goes through a birth like that, right? So
Yeah. So Carol, Ann's sister, is my best friend, Carol, and Carol and she's a PT as well. So both Ann and Carol are sisters and they're both PTs. And so Carol introduced Ann to me and my work. Boy, that was way back when too, wasn't it?
20, how many? Mitchell's 20, yeah, 28,
Oh my
and
God.
so 29.
I think I was just doing pelvic floor stuff at that time. I hadn't developed any of what I'm teaching at that stage of the game.
No, but Carol was saying, and I went to go visit her, and she's like, "You need to see my friend Lynn. She will help you. You don't have to suffer." And I remember you working on me in some odd room, and you just kept saying, "Oh, girl, oh, we need more work. We need more work." But then, how many years later? Because I think I took your courses. Well, when I started practicing as a pelvic PT, I didn't really have a mentor here in Columbus because mine needed to move back to Cincinnati. And so I remember talking to Carol again, and I said, I don't know what I'm doing with these people. And she said, call in. Call in. Here's her number. Call in. So I would like be on the phone with you. I've got this person coming in next, and you're like, listen to the tissues. And I'm like, what are you talking about? And so finally I thought, maybe I should go. You started having courses, and I'm like, maybe I should go to a course. And I was hooked. Yeah. So
Wow.
we had our first course at your house in Longmont, right? And it was phenomenal. I Everything about it was phenomenal. I just remember like running through the mountains in the morning, and just the weather was beautiful, and it was such a great learning experience, and I'm like, I'm doing it all.
Cool. Because that was early on in your pelvic health career,
Hmm.
right?
It was. Yeah, it
So
was.
what did you notice about applying what you learned in my courses to your clients? What were the results you were getting after taking my courses?
Oh, like night and day better. Because like things where, even though that was the pregnancy related course, there's still a lot we learned in treating postpartum. And plus, I think you showed me a ton on the side. And it was like, because I was just desperate. But I was never really good at all the release techniques I was learning through my pelvic training, and just, oh, you just push on this muscle and you say, and you make it let go. And then boom, everybody gets better. And that never worked. I'm like, that just doesn't work. I don't get it. And like Kegels just didn't work. Like after having babies and stuff, it just sometimes it just didn't come back. And you can say, sure, you look like you're doing great. And in the back of my head, I'm like, this doesn't make sense to me. So after taking the courses, realizing that there's other approaches to it, and looking at the bones was a game changer. Looking at the pelvis, looking at the rib cage, looking at how the breath is moving by, just by putting your hands on places other than the pelvis, was huge. And it's not that they didn't teach us that, but I just didn't put it together, and I couldn't grasp. I don't know, maybe it was too much
Yeah.
like insert the fire hose and just try to absorb and put it back into your practice. But it wasn't until we got there and started seeing there is an approach you can take to looking at a person and talking to a person and seeing where you go first. And then once you work with the bones, I was amazed the first time I went through a common birth pattern and rechecked their pelvic floor strength, and there was their Kegel. And I was just like, whoa. So that was that was amazing. So starting to practice, looking at people a little bit differently after that was a game changer.
Cool. And so, Anne, so you're getting all the success with what you learned in the courses in your clinic. What made you decide to become certified?
Well, first of all, I'm a person that likes to check off boxes. So I was like, yeah, we got to go there. We went everywhere else because I think I did all the other courses, and I'm like, I've gotten almost there, so why not, right? But then going through it, was so helpful in just finding a system, like in putting all the pieces together. And especially like as I came through a case, and you're looking at your case and why you did what you did and what you saw from start to finish, like 6 cases through, you're like, well, this makes complete sense. And each person was completely different, but being able to use the same systematic approach and then pulling from that approach, this is what this person needs, was what solidified, oh, this makes complete sense. So before, it was great because it was a whole bunch of tools, that I could use. But when I did the certification, I saw it was more of an approach to care.
Nice, nice. So more of how to use those tools and which order to use those tools
Mhm.
happened
Yeah.
once you did the certification piece.
Yes. And it gave you time. Yeah, it gave you time to really kind of sink your teeth into that the meat and potatoes of the work. And things that you would say over and over as you kind of were pulling your cases together, and then looking back at those things, you're like, oh, yeah, that makes sense. The rules, respect the tissues and never cause pain, and don't chase the pain but don't cause the pain, and um, never force a release. All those things were so like in my nature that that sat with me. But it was like when I looked back at my cases, and some cases that I wrote were ones that kind of went wrong before they went right, and I was able to see why they went wrong because I didn't listen to the body. I could feel like working on somebody's C-section scar and how like the body was just saying like, no, don't go here. But I thought, no, we have to work on C-section mobility. And I did. And she, for a very short period of time, came back the next week. She was like, it was really, really sore, and realized that's not where I needed to go, and went to the rib cage and did all the lung, the visceral work that you teach, the lung release and the liver and stomach balancing, and all of a sudden the scar mobility was fine. So it was really interesting. But I think some of those cases helped me to see,
Yeah.
yes, there is an order, and if you follow the order, it helps you. And when you don't follow the order, that could be why you things don't go where you expect. And it's not that the actual approach or the technique was wrong. It was just maybe in the wrong context or at the wrong time.
Right, right, yeah, and I've had another friend who was working with a client, and, it was actually for one of our presentations at CSM, and, it took her 2 sessions to get the release because she didn't do the 1 step to it,
Mhm.
and when we were discussing the case study, she was just like, "Oh," and she didn't get certified yet, and so she didn't have that opportunity. She knows now after, going through the case studies. So there is something about writing up a case study. And part of the certification process is one, you got to take all the courses. But then the next step is there's 2 written tests. They're like 50 questions each, one for the pregnancy and one for the postpartum. So you need to pass that. And then there's a skills assessment where I just choose 5 random techniques and I watch you do them on someone. So I'm looking at hand placement, motion, what you're doing, and all that, so that I know that you really understand these techniques. And then the last piece to it is the case studies. And you need to write 2 case studies for pregnancy, a case study on pregnancy, 2 case studies for postpartum, and then 2 case studies using the birth healing intensive material. And I think that writing up of those case studies is really what helps you to realize the clinical decision making that you use in implementing this work. And so taking a course and just learning the techniques, like Ann said, are just tools in your toolbox.
Mhm.
But the certification is really about understanding the clinical decision making that you need to be successful in applying those tools, and when to apply the tools, and when
Mhm.
not to apply the tools. So
Mhm.
yeah,
Mhm.
that
Exactly.
yeah.
Exactly. Because I thought, I used to think that a lot of like the care I give is like me doing something to somebody, right?
Well, that's what we
And
learn in PT school, right?
yeah, yes, you do a manual skill. You assess a body and you see what is lacking, and you give an exercise, corrective exercise plan, right? You do something to somebody, but a lot of your work is more that listening, hearing their story, listening to the body, hearing the body, what the body's reaction to things that you're doing, and then helping the person process what is going on in their body and what they need for healing. So there's a buy-in, and there's such a better healing when the person's like, oh, I
Yeah.
see what I need. And it doesn't have to be 100 things. It's just the right few things, and that's going to make the difference.
Well, and that's what I try to get across, is that when you do things in a particular order, like you found out with that C-section scar, if you work on the rib cage, the diaphragm, then hey, that lets go. There's less work to do there.
Mhm.
When you address the pelvic bones and mobilize and get those into a better position, the pelvic floor muscles don't need as much attention, as
Mhm.
much work. And
Mhm.
so it's really, really helpful to know that there's a way to approaching the body. And I think that, when you just go through the pregnancy and the postpartum course, it is about learning the techniques, but the certification takes it the next level and allows you to integrate it and help with your clinical decision making of how to apply this work to the body. So yeah, thank you, Anne.
Absolutely. Absolutely. Oh, thank you. Thank you.
Yeah.
It's been huge, and I just yeah, would encourage anybody who's in that process, just follow it through, because it's a game changer. It really helps you to understand the whole pregnancy and postpartum body. And so if that's the clientele you're working with, um, it's been a wonderful learning process of my own healing too, of everything that I've gone through. But I think we're on this world for a purpose, for a reason, and there's things that we go through for a reason. But then, you know, there are people that are put in your life to help you through it, and for a reason, so that you can also help carry that work on to other people. So I appreciate it. I think everything that you've done, um, coming to Columbus and teaching us, and then just all your work has helped a lot of people in our area. So we're all grateful.
Thank you, Anne. Thank you so much for being such a champion of this work and bringing me to Columbus and sharing this work with all your clients, and I know your colleagues as well. I really, really do appreciate that, because that is the best way to get the work out into the world, is that word of mouth and saying, hey, this really works. This is really effective, and I want more people to know about it. So I
Yeah.
appreciate you so, so much. And thank you for taking the time to share your experience with us today here too. I'm super, super grateful. And I hope those of you that are interested in becoming certified, please reach out, email me. I'm more than happy to jump on a call with you if you're interested in learning more about certification, or we have the page on the website. We'll put that in the show notes below. You can check that out. And yeah, get started on the coursework. Just start taking the courses, because that's the first step, is you got to get through those, and then we can get you on the path to becoming certified. So I so appreciate you. And guys, you're the best. And
Lynn.
oh
Thank
my gosh, thank
you.
you. Well, thank you everybody for listening in, and we will see you all in the next episode. Here's to more certified birth healing practitioners out in the world. Yay!
Yay.
That will help us to have smoother births and faster recoveries, everybody. Take care. We'll see y'all in the next episode. Bye-bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.